How hopeful are you that we'll get a vaccine at the end of 2020?
Well, there has been an unprecedented coordinated effort globally with an increasing number of vaccines which are in clinical trial in phase 3. So I think the hope is there. I wouldn't say necessarily before end of the year, but basically that's not the key issue. The vaccine is not going to be the end of the pandemic. The end of the pandemic is going to be when we as people are learning to live with the pandemic, and that can be even tomorrow.
But Mr. Kluge, first of all, how do you live with the pandemic? Does it mean that social distancing needs to happen at all times? Does it mean that, you know, mask wearing also needs to happen outside? And will people do it?
Right. This pandemic has costed far too much devastation and human lives. But at the same time, it's a kind of a dress rehearsal for future threats. It is not as infectious as measles. It's not as lethal as Ebola. So in that sense, we're living in a world of viruses. What we need is governments to take their responsibility and communicate clear, instill public trust and hope, and people to embrace the public health measures, some of those like you were just mentioning.
You know, governments are dealing with this very differently. It's different in France than it is in Spain, that is in Italy and the UK. Who gets it right? Is it safe, for example, to send our kids back to school?
Right. Schooling is an absolute must. Yesterday, I was co-chairing with the Minister of Health of Italy, Roberto Speranza, a meeting for all 53 countries on safely opening the schools. Children and learners have been suffering too much due to the school closures, from the education point of view, but also mental health, social well-being, and let's not forget also people who are unfortunately locked up in abusive atmospheres behind the lockdown. So it has to be done in a safe and gradual way. We cannot exclude that schools will have to be closed temporarily and locally, and that's something that we have to anticipate, but we cannot open societies without opening the schools first.
But Mr. Kluge, when you say that we shouldn't pin our hopes on a vaccine and need to live with the virus, would you say that people then should not go to work, but try and work from home? Like, do we need to act as if we were in like a half lockdown at all times? And is it because you don't believe that we'll have a viable vaccine, or that it will just arrive too late?
No, I am very hopeful for the vaccine, which is very, very important. And that's why WHO established the COVAX facility together with Gavi, close collaboration with the European Union, who is doing a tremendous job. So the vaccine is very, very important. But what I mean is, it's not a one-size-fits-all. There might be, we still have to work on vaccine hesitancy, for example, in many countries. And we cannot foresee which other viruses will come into our lives. So what I mean is, we need a new reality, where, for example, even in our own work environment of the United Nations, teleworking, digital health will become much more important, but leaving no one behind, because some people also are digitally poor and we have to help them.
How difficult are going to be the winter months? How much more difficult will it be once we're indoors, once we can't really go out, where we understand that the virus gets spread less?
I really thank you for this question, because the question I'm getting often is, we see an increased number in cases, but not in hospitalizations and in mortality, which is true. However, we see three phenomena coming together now when we will shift to the winter. One, opening of schools and the academic year. Two, the influenza season. And three, the excess mortality in elderly people linked to the winter. So we may see a more tough situation in October and particularly late November, but the key is we're not back in February. In February, we're caught off guard, and the default option was to lock down and reboot. Now we can target the virus and not target society by working localized.
But Mr. Kluge, would you shut down restaurants and bars to make sure that actually schools can remain open?
Well, the school is not a standalone environment. It is embedded in the community. So the measures in the school has to reflect the heaviness, the violence of transmission in the community. So if the community has sporadic cases, or there's really a very heavy transmission is different. What we need to do is stick to the basics. For example, avoid mass gatherings, wear the masks where we cannot guarantee a physical distancing of 1 meter, cough hygiene, hand hygiene, staying home when sick. So the basic measures. And we have to look at the epidemiological data, national and locally. And that's why I cannot give a general answer for all situations.
Can we reach herd immunity without a vaccine?
This was debated a lot, particularly in the beginning. What we see now is, number one, people who got the virus can get it a second time, still rare, but it happens. And secondly, that even in places where there has been community transmission of the virus, the herd immunity is about maximum 16%. So the majority of the population is still susceptible. So the virus is still there. If we see a better situation, it's not because the virus has gone away. It is because the drastic measures. So when we lift really the drastic measures, it's normal that we're going to see a peak.
But if people can get the virus again, and presumably once you have it, you should have antibodies, and maybe these fades, how can you still be optimistic about a vaccine that actually works?
Well, that are the caveats, of course. But as I was mentioning, we have never seen in history where public sector, private sector, the people themselves are working together for accelerating research and science. So I am quite hopeful that together, all the measures together, we will be able, in fact, to push back the pandemic. So for me, I'm hopeful, and we should give really hope to the people, but still we have to be vigilant and cautious. Ultimately, our behavior and the actions of the government are the most important. Where the response was drastic and prompt, the policy options were the right ones. But where the virus has been merciless is where we have seen partisanship, denial, and disinformation.